Ozempic here, Ozempic there. Everybody seems to be talking about Ozempic these days. Is it a miracle drug or just hype? By the end of this video, you'd know what Ozempic is. You'd know who should be using the injectable called Ozempic. You'd know how it works, the risk associated with its use, and many more. So stay tuned. This is Dr. Dammiee Medic TV. So a little bit of backstory here. I'm not going to bore you with textbook stuff, but it's good that we know this. Ozempic is actually a trade name for semaglutide. The chemical inside Ozempic is semaglutide, developed by Novo Nordisk for the management of type 2 diabetes. It was not intended for the management or for weight loss. It was something that was stumbled on. It was noticed that people who were placed on this injectable, they noticed that those people drastically lost weight. They lost weight whilst on Ozempic, and that was what brought about Wegovy, the cousin of Ozempic. So what's inside Wegovy is also semaglutide, but at a higher dose for weight loss management on the long term. Do you understand that now? Okay. So how does Ozempic work? Ozempic tends to Ozempic mimics what is naturally in the body called GLP-1, glucagon-like peptide 1. Just see it as your metabolic traffic warning. Okay, stop, you stay there, move to this side, and all that. And it is that hormone that works on your appetite, how your stomach empties, helps your pancreas to release insulin when needed, and all of that. So people who are on Ozempic feel full faster because that's semaglutide in Ozempic mimics that particular hormone GLP-1. So they feel full faster, they crave less, they eat less, and somehow their blood sugar is able to behaves better. So in essence, your brain, gut, pancreas start to have a more productive communication with semaglutide. So who is Ozempic meant for? We need to separate medicine from marketing. Okay, now Ozempic was developed, as I said earlier, for people living with type 2 diabetes whose sugars are not controlled on oral medications and other forms of management. They have the option of using the GLP-1 analog, which is semaglutide. It really isn't intended for weight loss, and if you're using it for weight loss, it is off-label. We call it off-label for weight loss. It should actually be used under medical supervision. For Wegovy, which is intended for chronic weight loss management, is for those with a body mass index greater than or equal to 30 kilograms per meter square, or those with or equal or greater than 27 kilograms per meter square with cardiovascular risk, 1 or 2 or more cardiovascular risk. What do I mean by cardiovascular? Maybe they have hypertension, someone is obese, or someone is overweight and also has hypertension, has high cholesterol, and the likes. That is what I mean by that. So what are the benefits of Ozempic? It is not just cosmetics. Okay, it literally saves lives. So it can actually reduce the chance of someone having heart attack and the risk of strokes in people living with type 2 diabetes. Amazing, right? So you see, it goes beyond the snatching and everything. You see, it can help to lower blood sugar levels. I said insulin starts to behave well. some studies have even reported up to 15% reduction in weight. And you see, when weight is reduced, when excess fat is reduced, the metabolism is better. People can also have lower blood pressure levels, even from weight loss. You can imagine something that reduces weight, the benefits that would subsequently accrue from weight loss. So it goes beyond just cosmetics, and it shouldn't just be about cosmetics for Ozempic, Wegovy, and things like that. Now let's talk about the side effect of Ozempic. People marketing it for weight loss alone won't tell you all this. Every drug is a potential poison, and you have to weigh the risk and benefits of using a medication before you go ahead to use it. Because if the benefit outweighs the risk, okay, fine, it's fine. But if the risk outweighs the benefit, or there's no justifiable indication for the use of a medication, then there's no need using it. The milder forms of side effects, things like nausea, vomiting, constipation, bloating, abdominal discomfort, and all of that are there. This usually happens because your stomach is emptying slower. But there are serious risks too associated with the use of semaglutide. Things like pancreatitis, that's inflammation of the pancreas. That's the organ that secretes insulin. Okay, that can become inflamed, and that can be very fatal. There have also we talked about gallbladder issues from gallbladder stones, things like the inflammation of the gallbladder itself, cholecystitis and the likes. Those things can be deadly if not managed well. And you also have the potential thyroid tumors. They've also documented the risk of thyroid tumors in animals, and it's still being studied in humans. So you should be aware of this risk. And because it suppresses appetite so effectively, some people undereat and develop nutritional deficiencies or fatigue when using Ozempic and all that. So you must be aware of the risks associated with the use of this medication. Okay, now let's address the elephant in the room: the celebrity craze. From Hollywood stars to TikTok influencers, people are showing off dramatic transformations, but behind the glamour lies a problem: supply shortages, misuse, and unrealistic expectations. Many people start Ozempic hoping for a quick fix, okay, but stop after a few months when they realize the hard truth. Once you stop the injections, the weight often comes back, and back with vengeance. Vengeance. That's because the lifestyle and appetite change weren't learned. Please, I'm gonna take that again. The lifestyle and appetite changes weren't learned, they were borrowed from the drugs. Should I take that again? The lifestyle and appetite change were not learned, they were borrowed from the drugs. And if you borrow something, if the owner comes to get their thing, they collect it back. So they stop the medication. People's lifestyles are still there. They still eat like hooligans. I'm sorry, scratch that. I'm not abusing anybody. They still eat anyhow. They don't exercise. They're not sleeping well. They're still using harmful substances, and those things are still there, but they're looking for a quick fix. And once they are not able to sustain the medication after some time, for one reason or the other, they stop. Their appetite hasn't stopped, and then the weight bounces right back. That's sad. Now, the future of metabolic medicine. So we need to talk about that. we're not going to throw any shade on semaglutide because it represents a revolution in metabolic medicine. In fact, the way people see obesity, the way people the research on obesity is being radicalized with the use of this medicine. In fact, there are other medications, next generation drugs like tirzepatide, Mounjaro, which have dual action molecules are being looked into. So somehow it's also revolutionizing the way we see obesity and metabolic health. So what are the takeaway from this video? So here's the bottom line. Ozempic isn't a villain, and it's not a magic wand. It's not a magic wand either. It's a powerful medical tool, but it should be used with wisdom, supervision, and long-term lifestyle support. In fact, I'm going to say what we need to deal with is the lifestyle first. The habit change, and then we can support with Ozempic or whatever weight loss medication. In fact, Ozempic and all the likes are not the only medications available for weight loss, but you must address fundamentally, as a matter of fact, the lifestyle aspect first. If you are living with diabetes, it might help transform your life if it's prescribed to you. If not, think carefully, talk to your doctor, and remember, there's no injection more powerful than a consistent and a balanced lifestyle. I'm gonna repeat that again. There's no injection more powerful than a consistent and a balanced lifestyle. Okay, so if you have not punched the subscribe button, what are you waiting for? If you have not clicked like, shared, or subscribed, turn on the notification button. What are you waiting for? Catch ya later. All right, bye. Dr. Dammiee here.